So as we know, with where we are, the Save Chorley and South Ribble Hospital campaign, obviously that started off because of our local services, i.e. the A&E. We've since had lots more information, more has come to light on what's happening. We've learnt a lot over the past 4.5 years. And one of the things that keeps popping up is this thing that they keep calling a super hospital. Now I'm going to talk a little bit about super hospitals, how it can affect us. I know Hillary's going to come and say a little bit about the Lancaster area and, you know, how it fits in with privatisation, and Michael sort of round off on that. So first of all, I think what we need to say, we need to explain that this idea of having this super hospital isn't a new one. It's not something we've been looking at for the past few years or something. This started in the 90s, when all those PFIs and the idea of having PFIs were out there, and that private money was then put into certain schemes. We just weren't high enough up the food chain to have that implemented in the 90s. But this has been an idea that's been going on since then. I mean, it's changed. There's been various business plans, different models, but the idea has been there since then. We were actually very lucky to miss that bullet, because if not, would have been, you know, the debt would have been incredible. That you're just paying off this interest for years and years on end. So that's the first thing. It's not a new idea. And for those who aren't quite sure on the latest that's just come out again, that's re-emerged, they're looking to actually close Lancaster Hospital and Preston Hospital. That is the main plans. Now this is because the buildings, we haven't had the input for decades into the infrastructure of the buildings, the facilities and everything. They're a mess. You know, they're not, as they would say, you know, they're not really fit for purpose. A lot of the buildings, I mean, Chorley isn't too bad, but Preston is. It really is. It does need a lot of work doing, and there's nowhere else for them to expand. So this is a lot of what they're looking at there. Lancaster was named in the Naylor report, which is about the sites and the conditions of the sites and the assets that the NHS own. So and that was looking at to be in a terrible state, and again, it would be more cost effective in the long term if you got rid of that hospital and got a new one. Now this, it sounds brilliant. It's absolutely great. But the problem is there are two business plans on the table. One is to shut both Lancaster and to shut Preston, and to have either 2 new smaller hospitals for each area, or it is to have one somewhere around the Garstang area that would cover the whole of Lancaster, South Cumbria, all around that area, and right down to Chorley and up. So that is a huge, huge area. Now, the idea, this is being sold on 2 main accounts. One is that it's going to be bright, shiny and new. So you've got all those, you know, as long as you look after that building, you've got the most up-to-date tech in there. You've got all your, it's going to be a centre of excellence. So you've got every single area that you need that can cover for any possible medical emergency in that place. Don't get me wrong, it's going to be absolutely brilliant. However, especially if they're going to use, which is the preferable one at the moment, the one hospital to replace those 2, you've also got to understand that if they take the A&E out of Chorley, you've lost that, and it's looking to become a cold site for only elective surgery. So so that's another hospital you've lost there. I'm not too sure as you're going up towards Lancaster, maybe Hillary can fill in a little bit on that, on what services they have there. But you're going to lose all that just to have this one hospital. Now, that's great, except in the past, all the way, every time they've ever done this, they've ever reduced it down to one hospital and put them all into this, you know, sold it as this centre of excellence. It's a lot smaller than the whole of what they're taking. So Lancaster covers a population here. Preston covers a huge population here. However, this so-called super hospital, which from now on I'm going to call a one-site hospital because there's nothing super about it. I really do have to stop doing that. That one hospital it won't have the capacity to see as many people as the whole, as it used to. So it is in fact a reduction in services, and quite a huge reduction. Now, I get it. It's brilliant having a new spanking brand new hospital. It's brilliant having the most up-to-date tech in there. It's brilliant having all your experts in one place. They can give the best service. But if you can't get through the door because the waiting list is that long, it's useless. It means that the only people that they can see are when you're at your most critical stage, because they will be the ones that are clinically prioritised on the list of people to see. So you could actually live next door to this hospital and still not get through the doors to see the services. So that's the first thing. What we've seen while they're doing this, obviously, is these hospitals as well, they aren't including all services. There are some services that are now being pulled out of hospitals and being farmed out to private clinics. They're being farmed out to GP surgeries, and usually on a very reduced scale. So again, waiting lists are getting really long. My daughter had to go, for example, this is just to see a nurse practitioner. She'd burnt her arm. She had to go and get it changed with the nurse, could not get an appointment with a nurse anywhere in Chorley, South Ribble or Greater Preston for 3 weeks. So that's how much the services are reducing. And the more that they're pushed out into the GP surgeries, into the private clinics, or onto things like cold sites, which is a little bit like what Chorley's looking like it's going to be if they get rid of our A&E. It's just going to be elective surgeries. So yeah, you've got this wonderful place, but with great big waiting lists that you can only get into unless you're at your most critical. So only the most ill people will be seen. So what happens, what we haven't been shown before on plans for things like these hospitals, is what they are going to do to replace those services that they're taking out of the hospitals. Because that really is, they say it's a different project, they say we don't need to look at that just here, but we do. If you're removing this hospital as a whole, and you're removing this hospital as a whole, and you're sticking something in the middle, we need to know that that is replacing the services that are being lost. And we're not seeing that at the moment. The other thing they're selling it on is, of course, everywhere has a shortage of staff. And this it compounds the idea that it's going to be a smaller service. Because what they're saying is, if they just had the one site, they would be able to redeploy the staff from Lancaster and redeploy the staff from Preston, and they would then have enough staff in this other hospital. But you've still got the same amount of staff. So you're not providing the same services, you're just providing the services for the staff where you've still got the missing staff. So you're only providing the services that you can with those staff. It is a highly reduced service that usually comes from it. So we need to know what's going to happen when we're looking at these plans, when we're coming up to it. We're also looking at one place in the middle. Obviously, there's the actual practicality for patients. You're looking at one hospital. We're right in the south of this area that this is, Chorley itself. We're right in the very south of the area that this hospital's supposed to be covering. We already saw what happened to the A&E at Preston when they shut Chorley. We saw what happened to the A&E at Wigan, at Bolton, at Blackburn, how overrun they were. If they remove these two A&Es and just stick the one in the middle, you don't only have the time it takes to get there, because that increased time, the NHS England has stopped talking about the golden hour now. They've stopped talking about it because they can't meet the targets with these plans. Can you imagine trying to get, halfway to Lancaster in an emergency, and you've got an hour to get there, for the best chance of survival. You know, the roads are blocked, motorways are blocked. We've got enough problems just getting to Preston, plus the fact you won't have the same capacity in the one hospital to cover both Lancaster and Preston areas. So the waiting lists will be even longer. So it's part of the privatisation process. If you think of private healthcare and what it will provide and what it can provide, it's private health insurance. They do not want to provide services that have a high risk. Insurance companies are an exclusive service, right? They don't provide life insurance. If you've got a terminal illness, the odds of you getting one are less. Travelling, again, break your arm, they're not prepared to insure you to travel because of the risk that can happen. Car, if you've had a couple of crashes, the premium goes up because it's a higher risk. Now in healthcare, what that means is if you have a pre-existing condition, they don't want to insure you. They want to provide as few of the most expensive services as they possibly can, and they expect people to pay to go and see a lot of these, especially if it's considered non-life threatening. So we're already seeing services being taken off the NHS. They don't want to pay for those expensive services, which are basically very much emergency care, maternity, and mental health. They're huge. And these are the services that are being reduced. The ones being sent out to the cold sites, to GP surgeries, to the private clinics, they're elective surgeries and they're being reduced. If you can't get in, you're expected to pay for them. And the super hospital compounds this again, because you've only got the service for the centre of excellence for when it's your most critical, when it's the necessary ones, the life-saving services, and then they don't want to see you outside of that hospital service again. They don't want to be paying that out. So what I want to really say here is, before we get into like the capitated budgets and things that they're looking for personalised in a different parts, they're talking about you having a private pot that you can spend. That is, you've got up to a certain amount to spend per person, a certain amount to spend on stroke services, a certain amount if you go over that spend, you just no more service there. So all these reductions, if it's put into this one pot, we need to know what that one hospital is going to be providing. So what we need to do, we're not saying we don't want that one hospital. We're not saying it won't have certain advantages. You know, we're not saying it's a completely bad thing. However, what we do need to know before any public consultation comes up, we need to know what capacity it's got in comparison to all the services that those two hospitals are providing now. We need to know where all the other services are going, and that people still have access to full services and not travelling the length and breadth of Lancashire and South Cumbria in order to get them. Not to come from Kendal to Chorley because that's the only place that you can get a certain service. That isn't acceptable. A lot of people can't do that. So we need to know what's happening there. We need to know what staff terms and conditions are going to be, because there'll be a huge change when those staff are being redeployed. That needs to come out before business plans are accepted. Staff need to know what they're being thrown into. We're not getting all these things at the moment. We're getting a generalised business plan that says it's better for one hospital. It's better because the existing hospital structures aren't efficient anymore. It's better because we don't have enough staff to run the two facilities. We would be all right. We'd be fine if we could just merge the staff. And, you know, they're saying it's a centre of excellence. What we also need to look at is on where those services that have been farmed out from the hospital that are going to be provided somewhere else, we also need to know what access they have to a centre of excellence. Because a lot of these are elective surgeries, they're elective consultations. That means that if anything goes wrong, you then have to travel from that facility to the nearest A&E, because that's the only way they can do it. So it's not just, you know, it's great having this centre of excellence for the most critical, but we need to know that there is the backup and the resource for all those services all the way down the line. So from my point of view, it's one hospital will never be enough for the two areas. We need to be pushing for the two hospital site plan if we're going to go for it. That one site hospital, if it's going to be for Preston and Chorley and South Ribble, for Central Lancs, that one site hospital, we need to know what is going into that hospital and the capacity for it and where the other services are going. We need to know what's happening with the staff. We need to know all this before they bring it in, because we can't afford to have any more reduction of staff. That sounded like complete waffle to me, because it usually does when I'm saying it. But if anyone's got any questions, please pop them in the chat. There is plenty of information, and I'll hand back to David. Thank you. Can't mute.
Well, I can mute you anyway, Jenny.
I just say that, right?
So, thank you, Jenny. Why have I not popped up? Have I? Oh, right. Right. I don't know why I've not popped up. Okay, so has anybody got any urgent questions? If they would like to raise their hand as a participant or pop up the reaction hand, you'll be welcome to ask questions. One of the things we've got to remember about what Jenny's saying about farming services out to little clinics and GP surgeries is that GPs are all private businesses, and they're there to cream off the profitable services that they can get. Pamela says she's off to Lytham for a skin clinic. Now, my mum's off for an eye clinic on Friday, somewhere out in Deepdale. These things are getting farmed out all over the place to quite significantly inaccessible places if you haven't got your own transport. And they're, you know, significantly profitable for the people who are actually bidding for and acquiring these services. Right, so now it's Hilary from Lancaster's go. So I will unmute her. Whoops, unmute. Unmute, come on. And we'll go back to speaker view. Where's Hilary gone? Lost you.
Here, I'm here.
Oh, you there? Right. Okay. It's your go. You should pop up now.
I know. I haven't popped up to me. Have I popped up to everyone else?
Yes, you've popped up, yeah.
Okay. All right. Thanks, Jenny.
You haven't popped up for me.
Thank you for that introduction, Jenny. And first of all, I'll just say a little bit about Lancaster Save Our Hospitals, the campaign. We were set up in 2013 originally, when our A&E at Lancaster was under threat of closure, and we had a very proactive, broad-based campaign, and we actually managed to save our A&E department at that time. Since then, we have organised coaches down to London for big NHS demos. We've supported the junior doctors when they were on strike. We've been part of supporting NHS workers locally during the current pandemic, including earlier on when it was the clapping on Thursdays. We organised to go up and stand outside of the hospital when nurses and other staff came out, and we were out there, not just clapping, but with banners and placards with demands for PPE and more pay, etc., etc. And currently we are, we've got an active Facebook group, and we've been putting out a lot of stuff about the pandemic and the kind of total failure of the government to deal with it properly. But now, of course, as you all know, we're facing a really big threat with the proposed closure of Lancaster and Preston hospitals, and a replacement with this kind of this super hospital somewhere in between. So when I use the word super hospital, I also, you know, I don't, as Jenny said, we don't recognise it as being a, you know, super in the kind of this will be brilliant and solve all our problems type of way. Because it will have huge implications for healthcare across the whole region, not just for Lancaster. And as Jenny said, you know, we all want the best services for everyone. Of course we do, that's, you know, obvious. But we do recognise that the existing site, the physical site at Lancaster, does need to be improved. And that follows years and years of underinvestment, and there's a lot of very old buildings on that site. But that doesn't necessarily mean that that site can't be improved. And it seems to us that having one hospital serving such a huge area, a lot of it rural, will just not work. And we know already that people in the South Lakes area of Cumbria have to travel some of the longest distances for hospital treatment in England. And so replacing Lancaster with a new hospital further south will just add even more time to journeys. So at Lancaster, at the moment, we have full A&E, 24 hours a day, 7 days a week. We have a critical care unit, we have consultant-led beds. With maternity, we have midwife-led and obstetric consultant-led care for high-risk and low-risk women, 24 hours a day, 7 days a week. And of course, if some of those services move to a new hospital in a more remote location, then all of those services become immediately under threat. We also have a hyperacute stroke unit with 6 beds at Lancaster, and if you move something like that to a central location further away, that's just potentially disastrous, I think. You know, with something like a stroke, time is of the essence. And if you're travelling from South Lakes and you've got to get down the M6, halfway down the M6 somewhere, if there's been an accident, or even if there hasn't, you know, it's adding extra time, critical time to a journey. We've already started seeing letters in our local paper, and councillors are already reporting that people are getting in touch with them and with the MPs, saying how worried they are about the idea of this remote hospital and the effect that it's going to have on services and accessibility. As David's already said, you know, what if you haven't got transport to get to these sites? Will there be public transport? How will workers get there? They've got to get to a new site every day. How much time will be added to people's journeys? All these a dispersal of services that may also follow. You know, people have got to be travelling all around the place for routine appointments, let alone emergencies. So we really see this as a massive threat to accessible healthcare for most of the people in our area, and it's great to have made links with your campaign, and hopefully there will be lots of other campaigns setting up because this is going to have a huge effect on all of us. So I'd like to send solidarity really to the Protect Chorley campaign and other campaigners here, and maybe next time you have your protest outside Chorley, if I know the details, I'm very happy to come along. And yeah, let's all work together and win. Thank you.
Right, thank you, Hilary. Now, has anybody got questions for Hilary, or do you want to wait till the end? Going off the participants list, there aren't any hands up, so we'll go to Mike. Okay, Mike,
Thanks,
you
David.
should be on now.
Yeah, thank you. And hello, everybody. And thank you for inviting me to this meeting, which is clearly a Northwest meeting at the moment and preoccupied quite rightly with issues that affect your local area. Yeah. I should say that I am the chair of the Hands Off HRI group, which is a group that was set up in 2016 in Huddersfield, because we faced and still face exactly the same issues that both your last two speakers have described. So we have two hospitals now within the trust, Huddersfield and Halifax. Halifax is a smaller town than Huddersfield. It's 8 miles away. The travel routes are appalling, but you can guess, of course, that the trust wanted to centralise A&E and acute emergency services at the Halifax hospital. Why is that? Because the Halifax hospital has one of the worst private finance initiatives in the country. It has saddled the whole of the trust with a massive debt, and they can't afford for that hospital to be downgraded in the way that they perhaps might have done at the beginning of this alleged consultation, because they've got a huge PFI debt to pay. So our campaign has done many of the things that all of you campaigners have done. It's been a huge campaign. It's been the biggest community-based campaign that this town has ever seen. We kicked off with a demonstration of 8,000. We have had links, particularly with the Chorley campaigners and others, and have learnt, and as we all need to learn from each other about the issues that we face. I'm not going to go into the detail really of the last 4.5 years, longer than the First World War, and it sometimes has felt like that. But we realised that if this lot were going to be stopped, we had to take out a legal challenge. The main focus of the campaign, as well as maintaining our public profile, was to raise money to ensure that we could prosecute a successful challenge. And once we got to court, in the pre-hearing for the judicial review, we were able to seek agreement from the chair of the bench that the trust had acted illegally, and it was proceeding to a full judicial review on 5 different counts, one of which that is mentioned in the chat thread was around the legal obligation to consult. That panicked the Secretary of State, who was then Jeremy Hunt, who in the meantime had received a referral from the Joint Health Scrutiny Committee in Kirklees and Calderdale, the joint council that oversaw the process, and they referred it to the Independent Reconfiguration Panel. And the panel decided that the trust was out of order and they needed to go back to the drawing board and start again. So we felt that we chalked up an important victory without having to go to a full judicial review. But as you would expect from the next Secretary of State, Matt Hancock, not that we have any illusions whatsoever in Jeremy Hunt, The Trust came up with a fresh proposal, which was to keep our A&E open, to keep the hospital open, because they intended to close the job lot. But they still want to downgrade our A&E and to transfer acute and emergency care over to Halifax, pretending that there will still be some kind of service in Huddersfield. We met with the Trust actually yesterday. Very difficult for me to keep my cool in those meetings. They're claiming they don't need to reconsult because they had a full consultation in 2016, and it's just a development of their plan. So they've shifted the goalposts and off they go again. Now, again, I could talk a lot more about that, but I think we have to ask ourselves the question in this meeting: why are trusts concentrating and centralising services? This is not about providing quality healthcare. What this is about is money, and it's about staffing. And it's also about the very hidden but increasingly open agenda of this government to privatise health services. And that is going to require coordinated and effective resistance if they're going to be stopped. It's about money because they've underfunded the NHS, which I'm sure you all know, by £24 billion over the last 5 years. It's also about staffing because there is 100,000 staff vacancies in the NHS. There are 40,000 vacancies for nurses in the health service. They tried pretending on the news this morning that they've recruited 15,000 nurses, but many more are leaving the NHS. And it's about privatisation because this government want to defund the NHS to the extent where people realise if they want proper health care, they are going to have to pay for it through private health insurance. So that's the agenda of the Tories. And that brings me on to the national picture. Because as National Chair of Health Campaigns Together, the one thing that we do have to feature in this meeting is the pandemic that has swept this country over the last year or so. The Tories have made the situation far worse. They have refused to take the issue seriously. They delayed us going into lockdown. They have squandered £12 billion on a test and trace programme that is in the hands of the private sector and clearly is failing. We have the 4th highest death rate in the world. We have, unfortunately, in the health and social care sector, seen just over 600 deaths of frontline workers. And 1/3 of all deaths in this country have been in the care homes, which is a huge national scandal. And our response to this pandemic has got to be, again, coordinated and hard-hitting. Of course, what's more difficult about that is that we are in a situation where we're in semi or full lockdown. It's difficult to organise protests. It's hard to make our voices heard. But what we saw during the course of the first lockdown was the huge solidarity and community support that there is for our National Health Service. And we wanted to build on that to try and coordinate the resistance. And so on the anniversary of the NHS this year, we held a national online rally and we urged local campaign groups to go out and protest. The Tories are very, very sensitive about what they're doing to the NHS. I also think, despite their majority, they're an extremely weak government and can easily be forced back on the whole question of NHS funding. But their agenda has to be tackled head on. They have used this pandemic to actually proceed quicker with what they intend to do. For example, one speaker mentioned the online consultations. They wanted to do that before the pandemic, and now most of them are taking place online. It's highly unlikely that we will go back to face-to-face consultations in primary or in secondary care, and that will have to be tackled. For us in Health Campaigns Together, we see there are 4 areas where we are going to have to struggle and fight. Obviously, it's around cuts and closures. And if we coordinate our efforts, we will be a lot stronger. But fortunately, the nurses are organising in the NHS. There are 85,000 nurses now on the Say No to Public Sector Pay Freeze Facebook page from all of the different unions, RCN, Unite, GMB and Unison. They are campaigning hard to secure a pay rise, because you might recall, of course, in the latest pay rise that we saw, police, magistrates, teachers, Civil servants got a pay rise and nothing for NHS staff. An absolute disgrace when they saved Johnson's life. But they are now campaigning for a pay rise. We heard yesterday in the meeting that we had with the trade union leads that the pay review body was due to report at the end of November, and now the timetable has slipped and they don't have a date around which they're now obliged to report. I think the national unions are under an obligation now to get ballot ready and move towards industrial action and support those nurses who are actually chomping at the bit to take action to get decent pay, because we're going to lose more nurses unless they get proper recognition and unless they get proper pay and conditions. Of course, there's also the whole issue of personal protective equipment, which was also put into the hands of the private sector. And without the PPE, then they're not only not able to do the job, but too many of them died on the front line. The other issue, of course, is cuts, and we're demanding that there should be a restoration of the NHS budget back up to the European average, which is 12% or 13% of gross domestic product. In this country, it's slipped to 7%, which is an absolute disgrace, whatever the Tories might tell you. And of course, there's the issue of privatisation, which we see as a key issue if the NHS is going to be brought back into the hands of the people and to make it accountable to the people. Health Campaigns Together is organising a national conference against privatisation early in the new year. We are mandated as an organisation by our membership to take the whole issue of pay seriously, to support nurses in their campaigns and to lobby, and I urge you all to do the same, to lobby all your MPs to demand that the pay review body immediately convenes and decides on a pay rise for the NHS staff. And lastly, of course, we've got to mention social care, because we have an acute crisis in social care at the moment, which remains mostly in the hands of the private sector. Those care workers who are delivering acute and emergency care to their residents are still paid the minimum wage, which is a disgrace. We recently had, with Keep Our NHS Public, a national social care conference. We're coordinating with the unions to develop organisation and resistance. But I think this is the best time now in this pandemic, which is an opportunity. I don't apologise for saying that. It's an opportunity for us to raise the crucial importance of bringing social care back into the public sector, so that people are not having to, in the postcode lottery, looking at bank balances, whether or not they can afford the care. And I should mention, by the way, I heard today that someone was told that they could not have a test because their credit history was poor. That shows where the priorities of Sodexo and Amazon are when it comes to providing tests. So bring the social care back into the public sector. That we as health campaigners have to raise a storm. We have to mobilise and organise the public support that still exists for the NHS. We've got to put every politician under maximum pressure to make sure that they deliver on the programme that I've outlined. And we also have to ensure that the unions are brought into that struggle and assist their workers in the workplace to ensure that they're getting proper pay and conditions of service. Like I said, halfway through, I think this is a weak government. We have seen Sunak and Johnson and Hancock perform more U-turns in the last 10 months than the previous 20 years of national government. They're in an absolute mess, but so is our country. And if we're going to resist what's taking place, it requires mobilising popular opinion around a fighting programme to save our National Health Service.
Right. Thank you, Mike. Now, we've had three excellent speakers, and a number of people have raised hands to ask questions, so I'm going to go to them in a moment. And then I'll let it go free for everybody to ask questions. One thing we've got to remember, this government and any government will go on about the amount of money they're pouring into the NHS and the huge rise in funding that they're putting into the NHS. What we've got to actually realise is where it's actually going. the Tories especially see the NHS as a cash cow for their mates. And on current performance, what's happening is money is going into the NHS, yes, but it's going straight out again as private profit for services supposedly provided, like the NHS Serco test and trace, where we've got £12 billion and not a penny of it's actually gone into NHS services at all. So we need to follow the money. Now, Hilary had a question first, so I will unmute you and away you go. Hilary?
No, I didn't. I hadn't put my hand up. I was giving a thumbs up reaction to what Mike was saying. Sorry if I confused you, David.
It was the wrong reaction then. Right. Okay. So Gary's got a question. So you should be okay to go now, Gary.
Can you hear me?
Yep.
Can everybody hear me? Thanks. Just going back to what Hilary was saying, I think it might be a bit slow, it's breaking up a little bit here. Can you still hear me?
Just about, Gary, is breaking up a bit.
Yeah, you're very crackly, Gary. Your connection's a bit rubbish because your video's very jerky. No, sorry, we can't hear you. Do you want to put it in the chat and I'll read it out?
Gary, try switching your camera off. It might improve the voice.
Yeah, that's true.
Well done, Mary Whitby.
I think he's frozen.
I think he's frozen, yeah.
Yeah.
I think what we need to be looking at the moment, and obviously when Gary comes back, I'll leave the floor to him. What we need to be looking at the moment with this, this one site hospital, we need to, we need Preston, Chorley and South Ribble to be looking to get, make sure that we get that 2-site hospital on a local level. We need to be having a look at that we get it, not the one replacing 3 hospitals or more, but just have the, if you're going to have a new hospital, then let's have one to replace Preston, and let's have another one, that Hilary and everyone there will be fighting for the local side of it, that they have their hospital there, and that's all on survival rates, and as Hilary quite rightly pointed out, how we're not going to be able to access those services so far away and so at such a reduced level. But we also need to be, keeping in touch. It's great that we managed to get in touch with Hilary a couple of weeks back from Lancaster, doing something very similar to this. But we do need to be looking at it, at a regional level. All we're doing is we're waiting from Cumbria Health Scrutiny Committee and Lancashire County Council Health Scrutiny Committee. They're actually looking to merge, because obviously this is Lancashire and South Cumbria, and they're only looking at, all they need to do is confirm the terms of reference, and then there will be this new health scrutiny body, and that is where these particular plans will be coming up at. They're currently only held at at Lancashire level or at Cumbria level. They will be joint within the next few months, so that's something we're going to need to look out for and work together on. And I know Mary Whitby's here as well. She's like from West Lancs, because we've also got 2 hospitals there, that are quite possibly going to be shut down. If they shut Southport or Ormskirk Hospital, that's another hospital that we've got that is gone. So I mean, it's a great argument that we need one closer to be able to Blackpool too. I don't know what that. We need to be able to see if they're shutting things, how many they're shutting in the other areas. I'm saying it's not just a case of closing Lancaster and Preston. So, you know what, we will be in touch with Hilary and various other people across Lancashire and South Cumbria where we can, because there's going to be a coordinated effort as well. I'd also like everybody, you know, we're hoping to start a few meetings and get, you know, what's happening across the north, because Mike isn't actually that far away, depending where you are in Lancashire. You know, you could be taking, the way things are going here, we've got so few hospitals. It's exactly as you know, the domino effects that Mary's put here. You get a knock-on effect right across, and it just affects everybody's services. So we really need a concerted effort to do that right across the north. You know, get Liverpool, we're already quite close with Manchester, but you know, we've got brilliant campaigns over there in Yorkshire. I know, because I've been and I've followed them, especially Mike. But we really need to start getting these going. If we've got any union people here, internal, asking what is happening for the staff, those staff need supporting. The JMB and Unite are currently backing NHS Pay 15 for 15%. Unison are looking, no, Royal College of Nursing are looking at 12.5% at the moment. And Unison are looking for a straight £2,000. They're not quite as on board with it as others. So if any pushing in within your union circles to get more support for those staff, because they're really struggling in the campaign at the moment. From my point of view, I'm going to go. I'd just like to say thank you to Mike and Hilary for coming. Absolutely solidarity with you both, and we'll be in touch soon.
Right, I'm going to unmute everybody now so you can comment and talk about it. So, here you go.
There are one or two questions in chat.
Okay.
Yeah. Gillian says, do we know how many super hospitals there are currently throughout the whole country? And what's been the effect in those areas?
That's a very good question.
Yeah. Well, I've heard that down in the West Country, Devon and Cornwall, that their consolidation, supposedly, of hospitals has been a nightmare. And the actual getting to hospital times have doubled and tripled because of the lack of decent sized roads down there, basically.
There's also the, it's not necessarily a consolidation. So it's our particular plans here in the Northwest, they're looking to shut the whole of Lancaster Hospital and the whole of Preston and consolidate them there. However, they were looking, and the same in Huddersfield, they were looking to close originally the whole hospital to move all services over to Halifax, even though it was a smaller hospital. It was the one with the PFI that they couldn't get rid of. So there are all different ways of looking at them doing the same thing. If you look from Chorley's point of view, they're looking to remove the emergency services. So that will go, and it will just be a cold site it'll basically be a 24-hour doctors with elective surgery on. But those services then that were provided at Chorley are then being moved over to Preston already, or they're being moved out to GP surgeries. So it's not just that they're consolidating these hospitals to make these so-called super hospitals, although I don't know how many there are. It's I know there's been quite a few just like that, and it has shown a reduction in the services in those areas. So longer waiting times in the A&E, things like that. So it's had a knock-on effect for years. That is how the A&E, your A&E services, when they're saying about it, that's how they've got to this point, because they're reducing the services in other areas. Burnley A&E was shut. Blackburn had to take that on. So there are other ways of doing it besides just getting rid of the hospital completely. And that is consolidating those services into one area. The plans for privatisation, it's clumping everything together in a big package to make it financially nice for big companies to come in and take over. It's got to make it financially viable for them to come in and say, I've got this huge pot of money. Just Chorley Hospital wouldn't be worth the spend. But when you've got the whole of Lancashire and South Cumbria, and that's why we're seeing no duplication of any services across these huge areas. So there's only going to be one mental health critical level service, and that'll be there. There'll be one stroke unit there. There'll be, and each one, the cancer treatment will be there. So you're going to have to travel to those spots, to those sites. So even though you've got this one hospital, again, that's why I'm saying it'll be interesting to see what services they're looking to put in there. And will they cover the services that are already being covered at Lancaster? Will they cover the services that are already being provided at Preston? But also, will they then take that service off Blackburn and move it to that new hospital? Because that's the centre of excellence. And you just end up, those waiting lists, the population that it's covering just grows and grows and grows, and your waiting lists grow and grow and grow. So it's not always just a simple case of removing the two hospitals and sticking the one in. They're doing it in other ways already on smaller levels that they don't need public consultations for. They'll just move that one little service out, and nurses can do that at GP surgeries now. And bit by bit, that money is coming out of your NHS hospital and it's moving out to private companies, and which means that they can't keep as many buildings going, which is why they're looking at this huge reduction of buildings. So yeah, it's not like just like it's not just one like for like them closing two hospitals and reducing it to one. There are other ways that they're doing it in the meantime as well.
Can I just add to that, David, for Gillian's question?
Yeah, sure.
That the King's Fund carried out an investigation into the benefits of centralisation and concentration of health services and found that, as you would expect, services had deteriorated. So there is the evidence there, but their plan is fragmented and at different stages of development. So some super hospitals are being created, some are in the process of being created, and others haven't been developed yet. So it's very difficult for health professionals and campaigners to be able to quantify the impact that has made. But we should understand why they're doing it. They say it's in order to centralise excellence. In reality, it is the staffing shortage and the shortage of funds in the NHS that is driving this. We even have consultants who support the centralisation of services in one hospital say they cannot staff specialist departments in both hospitals. And when they're convinced it has to be done, it isn't for health benefits, it's because there isn't the staffing levels. So the crisis in the NHS and the centralisation of services is linked intrinsically to underfunding and the staffing crisis.
Yeah.
Adele, can you mute yourself?
I'll have a go. Bear with me.
Can you mute it? Yeah, okay.
Yeah, done it. Right. Does anybody else want to say anything?
Yeah.
I think Gary wanted to say something. He's come back now. Gary, are you there?
Yeah, sorry about that, Chair.
Right. Would you like to say something?
Yeah, so I have no video. I've only got the chat at the moment. I'm just going to go back to about 2003, where ministers used the mantra of a super hospital to close and centralise many, including ours over at Burnley. At the time, I think it was around about 2005, 2006. They brought out, the government at the time brought out a white paper called Our Health, Our Care, Our Say. And most of the models, the STPs of care that STPs are based on, it's basically a replica of that particular paper. The idea was to centralise the A&Es and bring in tertiary services as well into the hospitals, and some of the more lucrative more profitable services would go to the private clinics. But at the time, the PFI was in place. Over at East Lancashire Hospitals Trust, around about 17% of their budget went on the PFIs for. So they moved Burnley A&E, came back 12 months later and closed the children's inpatient department at Burnley Hospital as well. So ever since then, the hospital over at Blackburn, Royal Blackburn Hospital, has been in crisis management. We know that. So we've a lot to learn from history. It's very important to look at the STP, go back and look at the transformation plan for Lancashire and South Cumbria, because it's nothing's mentioned in there of any future super hospital. But we can see that behind all this, that was a ploy they were going to use when they subdivided each footprint, as they call it, into different areas. Our Central Lancashire, which covers Chorley, South Ribble, Preston, our health, our care, is basically exactly the same as what was stated in the STP. And before that, Labour's white paper. I've put it on my blog, and I think I've blogged it several times because we can learn quite a lot from that. But they've gone one step further as this government, and what they're doing now, instead of putting the tertiary services in the hospitals, they're moving them into the communities. But at the moment, they can't do that in Central Lancashire or throughout the South Cumbria and Lancashire, because they don't have anywhere to put them. But they used the idea of in 2007, when they moved the A&E from Burnley to Blackburn, there was no period where they went through a trial period where they were telling the North West Ambulance Service, look, should we move 10%, as we recommended then over the councils, both Rosendale, Pendle and Burnley, could we take a trial, if you will? So they've got to have, they didn't have anything in place to as Jenny mentioned earlier, to take up the slack, the capacity there. So they were already running, the trust were already running a deficit. Around about 17% of the budget were going on PFI, and they just went ahead and did it. And of course, we know what happened from that. They tried to put a surgical assessment unit alongside the medical assessment unit. That didn't work. They even put additional cabins outside, porter cabins. That didn't work. They tried to expand. I think it would similar to Go2Doc at the time. A private services came in, and that didn't work either. The long-term plan behind all this for Lancashire and South Cumbria is as the trust have said. By the way, we know that they bow and kowtow to the clinical commissioning groups. Is that this is a long-term plan, but they've got to get the short-term plan in place. And what campaigners need to be aware of is the new ruling that came out about 18 months ago from NHS England, which states that there must be alternatives. I think Mike touched on this earlier, Mike Forster, that there must be alternative services in place to allow for any services that are closed. And if they haven't, then you can't transfer it. So we need to look more closely at the support as well from the trade unions, and also from the councillors, because when this comes forward, we don't want to be in a position where we don't know who has the authority to actually stop it. Because my experience is when we campaigned to prevent the A&E going from Burnley to Blackburn, we all went down on a battle bus to Parliament. And basically, we had a Labour government in at the time. That's not going to stop it, and it didn't stop it. And so we can see what happened then was it went to what's called the Independent Reconfiguration Panel. And I think Mike knows more about this than most, I imagine. Because when it goes to the IRP, it does take advice then from ultimately, everything's changed since 2010, when the Health and Social Care Act came about, bill at the time, and that changed everything, because now we're looking at where they override the basic NHS constitution, because technically we don't have an NHS anywhere. So going back to the super hospitals, this is going to be dragged out and made particularly a lot worse with the pandemic, because they in some respects the trust will have this at hand, and they will be working on it every single day to get this public consultation through with minimal consultation. But I think if we look back now, history tells us quite a lot that our first line of defence has already been broken. Our first line of defence are the people that work in the NHS. and we've seen from the results from what come back from what's called the agenda for change, the pay drop. Many people say for the NHS workers, we can see that it's a disgrace. The unions coming back and actually recommending such a pay drop is disgraceful. The unions over the last 20 years, 20, 30 years, have a significant drop in membership. So it's been left to us in the communities to take up that work, and it's caused, no doubt, caused division. There are other things which we've gone through. I don't want to take up too much time because we've gone through this before. They're not super hospitals. There's nothing super about them. It's a rouse, and the Conservatives, call them what you will, I'm sure we have different names for them, are simply taking that tertiary step, and all the services, the community services included, won't be going to any super hospital. Effectively, what we'll have, if it does cover the whole of central Lancashire, I imagine what Jenny mentioned earlier, the longer term plan will be, as Simon Stevens would have predicted, within such a big country as America, is to have one single hospital for acute services, A&E effectively, and trauma for the whole of Lancashire. And that's where it comes in, because the Chorley MP actually said, well, we've got to look at this idea of a super hospital. And I'll never forget this, because he said, we've got to look at this in case we lose funding to Manchester.
Gary,
yeah, go on, David, sorry.
Gary,
the devolution for Manchester is...
can you just finish your point so other people can have a go, please?
Any devolution for any area, effectively, is dismantling of the NHS. Thanks, everyone. Thanks, yeah.
Thank you, Gary. Right. Well,
Just,
I think we
just on one of those points as a quick one.
Yep.
They were saying about the long-term plan and the short-term plans. When the Our Health, Our Care for us in Chorley, that is where they're looking to shut our A&E. Now, Our Health, Our Care, when they first started, this is over a year ago, they first came out, they originally had 13 business models that you could look at and that were to be considered. This is a couple of years back. Now, within those, that this was a short-term plan, they were asked at the time, why isn't the super hospital one of the options in this plan? And they were told that their answer there and then, this was during a Health Scrutiny Committee meeting as well, at Lancashire County Council, and their answer then was, these are short-term plans. What these are that developed from the STPs are short-term plans. Don't forget, it started off from NHS England as the 5-year forward view, that we were going to fit in these 5 years, and that's where the STPs came from. That was a short-term view. But they do now, after those 5 years, they then put it down to the fact that they've got a long-term view now. Then the plan is now called a long-term view, and that is exactly what our local NHS said. Why isn't there a super hospital in these plans as an option? Because that isn't in the short-term plans, that is a long-term plan. It would be at least 10 years before we could get another hospital. So you've got to think that, you know, everything is, they were expecting us to be closed already, and that our A&E would not be a consideration for this super hospital. But yet 4.5 years later, we're still here and we are still a consideration. So yeah, quite right what Gary was saying about the long-term, short-term.
Yeah. Right.
Excuse me. Hilary and Nick have posted quite a bit up in chat. Do you want to speak, yeah. Hilary and Mick?
Not really, so long as, hang on a minute, can you hear me?
A few minutes.
Yeah.
Not really, you can, as long as everybody can read the chat.
Right, okay.
The only thing I would add is that our family have actually had personal experience of using a super hospital, and what Jenny was saying is absolutely true to our experience. Our brother-in-law was taken into hospital in Northumberland as an emergency, and everything worked fantastically in that he had, scans, etc., and he had emergency life-giving emergency surgery at 3 o'clock in the morning. So that all worked exactly as Jenny was saying, you know, you're in emergency, you've got something that you're going to die of if they don't do something in 5 minutes, sort of thing, and it worked fantastic. However, when you look at where that super hospital is, it's actually south of Newcastle, and it is the only hospital available to residents of Berwick. So if you live in Berwick, now all you've got to do is to look at a map and see how long that is, and there is only one access road, which is the A1. And if there's an accident on that A1, well, you'd be dead, because my sister asked what would happen had they been in Berwick and not where they actually were, and they just said, oh well, we would have used the air ambulance because we're about to increase our fleet of air ambulances, but of course that's never happened.
And can I point out, isn't air ambulance a charity?
Yes.
Yes.
Yeah.
Can I ask the name of the hospital? Hilary.
It's the only hospital in Northumberland.
Right.
As in, I think I can't. Do you know? I don't know what its actual name is.
It's north of Newcastle.
It's just
sorry. Mick's just correcting me. It's actually a little bit north of Newcastle.
But it's a hell of a way to get to it.
It's just that my niece's husband is a brain surgeon in that
right.
area.
Well, yeah, it's probably there. Yeah. And I think that the plan was that all the local hospitals like ours, I think the original, this is what Jenny was, who's my sister, not Jenny. I think what Jenny was told at the time, well, of course, you know, she was so frightened, everything was just awful. And they were told that all the little local hospitals like Alnwick had their services reduced, but that the post-op surgery care had actually been improved. And that was one of the ways in which they'd sold the idea. Now, as it happened, they didn't actually experience it because our Jenny preferred to bring her husband home, and so he actually came home, but he would have been discharged from that surgery after 2 days,
3 days,
2 or 3 days, and he was still on drips. He was still, you know, it was very frightening, very frightening. And I you know, I can only stress, as this Jenny has said this morning, if you're in that situation, it works brilliantly, but God knows what they would have done if they'd have been staying in Berwick, which we all could, our family all quite easily could have done, because as you all know, we go to that part of the world a lot, and we could have been staying in Berwick as much as staying where we were.
The other thing, going away from that, Pam's made the point about never using the expression super hospital again, to try and agree on what we're going to call it.
In the plans, they're called one-site hospitals for NHS England. It's only like in the local areas, and they go on about it. That shiny is another word they keep putting in there, shiny and new. You know, well, it's not the only thing that you need. You don't just need shiny and new. You know, and don't forget, if that's the centre of excellence, that's the centre of excellence for everybody in that area. You know, the waiting is great when you're in there, you know, brilliant. However, what happens to the person not in a super hospital who's giving birth, and suddenly anything can go wrong, and they then have to be transported halfway across the county? You know, that's 2 lives at risk. It's just, you know, I'm all for new shiny hospitals. Great, wonderful.
Yeah.
Replace what we've got. You know, replace the services that they're putting in there in an area where the people can get to. You know.
And let's not forget, we've got a precedent about shiny new hospitals in Liverpool.
Yeah.
What happens to them?
Very good point. Yeah.
Thanks to Carillion.
Yeah. Is it time we decided when we're going to meet again and what we're going to do in the meantime? Are we all going to lobby our MPs against a one-site hospital in this area?
I think that's a good step forward. And it's not
By email
hard.
or
Yeah.
each individual.
Can I ask a question?
Of course.
And this might be a dumb question, and it's something I've been meaning to ask for ages, but with Kathy talking about lobbying, that it's just made me realise. You know, the CCGs, right? You can all laugh if you think I'm being stupid here, but the CCGs, they are supposed to be member organisations, aren't they? So my understanding of the legal term member organisation means that organisation has to have many members, and it's our local GPs who are the members of the member organisations called CCGs.
Yeah.
So
well,
can we?
Some of the members.
But aren't all of them? I mean, how does this work?
Well, you've got your members, which are basically your GPs, as you made up with your GP, you know, obviously of those areas. So you've got your general medical council. It's more or less replacing them. It's like a local medical council. So you've got all the members, your CCGs. The members of those CCGs are your GPs. However, you've then got the GP committee, and that is a mixture of business people. You've got your CEO that is not a GP, which we've got Dennis Gibson at the moment. That's the corporate side of it. You also have elected chairs of whoever's, you know, which is usually a GP, not in all cases though. So it's that committee that isn't necessarily GP. However, the membership is GP.
So what about writing to all the GPs?
We've tried that. We didn't get very far with it, but we did try it. A couple of them of the surgeries came back because obviously all the GPs in the surgery had that letter. We sent it to everybody. I hand delivered them actually, and it came back from the head of the surgery saying our GPs are being represented in the CCG. Speak to the CCG on that subject.
Yeah, the chair of our local CCG, we've met her privately. She asked to meet us, rightly or wrongly. We met her in the pub, didn't we?
Yeah.
But
no, you didn't.
I mean, she's
informal.
Yeah, she wanted to. She felt that we would have mutual interests, but you know, she's looking at her career. I've known her since she was born. You know, I've said to Jen and Mary, when you go to these, when you speak at the CCG meetings, make it clear that you have no interest, financial or career-wise, that you've taken a day off work to attend here today to make your case.
Yeah.
They've got careers to think about.
Yeah, there's always a lot of issues around the central one of the actual provision we're going to get, isn't there?
I think we're on nearly an hour and a half. Are we looking to round?
Yeah,
round
an hour and 31 minutes indeed, Jenny. Yeah.
Well,
when
so,
do we all want to meet again?
Yeah.
I think we said the first Saturday in each month we would have an open meeting. So if we will get those details out for the next one. If anybody wants a specific subject, can I say that, you know, maybe email back when you get your emails, you know, to standing secretary, just to or post it on our page, contact one of us, and we'll see if we could get some speakers and information around those different subjects.
Can I just close with about the video? We're trying to get the video. I'm just flogging the chap who's.
Can we leave this till our meeting, because this is a public meeting.
Yeah.
Right. Just because it's your birthday on Monday.
You've still got your hand up. You've still got your hand up, Hillary.
Which Hillary?
The other one. She's gone. Right. Well, very nice to see everybody.
Yeah. Thank you very much.
Thank you.
A most interesting and productive meeting.
And Hilary from Lancaster and Mike Forster from Huddersfield have gone now, but I'd like just to put a special thanks out at the end and solidarity to them. Thanks for them to come in over to speak.
Thank you.
Thank you, everybody.
Bye.
Thank you very much.
Bye,
Happy
everybody.
birthday, Jenny.
Happy birthday, Jenny.
Hey, happy birthday to you. Yours is today.
It is.